Absolutely. Here's how nursing students can predict when edema will occur so that you know when to be assessing for it and what kind of things you can do to help it. And if you haven't already watched the original video where I talk about osmosis and diffusion, go back and watch that because this is going to be a practical application of those concepts. First of all, you have to keep in mind that osmosis and diffusion are constantly occurring in the body. They're processes that work together along with a lot of other different processes to maintain homeostasis. I always think about it like when you're driving a car, even when you're driving the car straight, you always have to jiggle the steering wheel just a little bit because there's all kinds of little things that are constantly trying to throw your car off course. And if you want to stay moving straight, you have to make these micro adjustments. That's what osmosis and diffusion help your body do. And when it comes to edema, they're doing this with the fluid volume. So basically, where is the water in the body located at any given time? Now, there's three main compartments in the body. We talk about first spacing, second spacing, and third spacing. First spacing is just where is the fluid supposed to be? That it is where it's supposed to be, like in blood vessels and inside cells. This is where most of the water in the body is contained. Second spacing is when there's fluid in the interstitial areas, outside of the blood vessels and the cells. Now, it's normal to have some fluid there, but when we have edema, we're getting abnormal amounts of fluid accumulating in the interstitial spaces. And then we come to third spacing, which is areas of the body where we don't normally have significant amounts of fluid because it's really hard for that fluid to move in and out of those spaces. And it has to do with osmosis and diffusion pressure variance, like you might expect. So third spacing is when fluid gets into these spaces that it's hard for the fluid to leave. So it's abnormal for that fluid to be there. So let's talk about why edema happens. So if we have these different pressures forcing the water in one direction or the other, into the blood vessels, out of the blood vessels. And so there's always a constant movement of water going in and out of the blood vessels at any given time, just like the steering wheel kind of jiggles. Like if somebody has high blood pressure, that the hydrostatic pressures are going to be pushing water out of the blood vessel. But then you'll have the albumin in the blood vessel, and that means the oncotic pressures are going to be serving as a magnetic pull to pull water into the blood vessels. Same with the electrolytes, especially sodium in the blood vessels. That's going to be encouraging in osmosis to keep water in the blood vessels to dilute those particles and that electrolytes. But when these forces, it's kind of like, think of it as like an addition and subtraction equation, or more like a greater than or equal to equation. If the force pushing water into the blood vessel is greater than the force pushing water out of the blood vessel, then we won't have edema. We'll just kind of have a normal balance of fluid. But if the balance of pressure, if the fluid pressure pushing out of the blood vessels is greater than the pressure pushing the water into the blood vessel, now the water is going to want to leave the blood vessel and go flood into the interstitial space, causing edema. And this can happen at different parts of the body. Like maybe you don't have edema in your arms, but you've been on your feet all day, so and you don't have good circulatory return. So down in your feet, the pressures pushing the fluid out of the blood vessels is going to be higher than the pressures pushing in, whereas up in your arms, it might be kind of more normalized. And then you'd have edema in your feet, but not in your arms. If your kidneys are not filtering water properly, if they're not working properly, then you're going to retain more water. And this increased water in your body is going to increase blood pressure, increase the amount of water in the blood vessels, which increases the pressure pushing the water out of the blood vessels. And you end up with edema. So the point is that when you understand these underlying factors, then you can understand how edema can occur in a bunch of different disorders, really. Like think about heart failure. I mean, I could do a whole tutoring session just on heart failure. But to summarize, if you have left-sided heart failure, the left side of the heart is not pumping, which means all of the fluid, all the blood is going to be backing up. And if you know your cardiac anatomy and physiology, you know that the fluid then from the left side of the heart backs up into the lungs, which increases the pressure inside the blood vessels, which means that it's going to start pushing the water out of the blood vessels in the lungs, which is why you can see pulmonary edema as one of the symptoms of left-sided heart failure. And this gets your thinking really flexible, which is why I recommend studying with the silver bullet study system. It's the best way to study in nursing school because then you don't have to memorize like what are all the disorders that edema could occur, because there's a lot of them. But if instead you understand like the reasons and the mechanisms that tend to lead to edema, then you'll always be able to predict when edema is possible to occur. And then depending on the underlying pathophysiology, like the specific pathophysiology. Is it heart failure? Is it kidneys? Is it just gravity and being on your feet all day? Pregnancy? Then you can have a better chance of choosing priority nursing actions because you can customize the edema treatment to the underlying, pathophysiology or whatever led up to the edema in that specific situation. And that is the power of studying with the Silver Bullet study system, because it helps you improve your clinical judgment so that you can study like a nurse, so that you can think like a nurse. And you can get a free 10-minute overview video on how to use the Silver Bullet study system, all 4 steps of it, for free in my bio link. And don't forget to give me a follow for more nursing school tips.